Welcome you all for the Raaonline teaching program. I am Dr. Monica, your pediatric faculty. So today's topic is going to be one of the most important topic, which is inherited tubular transport abnormalities. So in the previous session regarding renal tubular acidosis, we have seen in detail about the individual renal tubular acidosis, that is proximal RTA, distal RTA and type 4 hyperkalemic RTA, and what are all the clinical manifestations, how they present, and in general how will you approach a child with a renal tubular acidosis, and the management part also. So today's topic we are going to see about two important syndromes, which is Barta Syndrome and Gentleman syndrome, which are the two most common inherited tubular transport abnormalities, and invariably in all the question papers, either in theory or in entrance forms, definitely as a direct one-liners or through some clinical scenarios, you may be frequently encountering the questions on this topic. So today's topic is very important. So coming to the Barta syndrome. So Barta syndrome is a group of disorders which are characterized by certain biochemical abnormalities, that is hypokalemic, hypochloremic, metabolic alkalosis, along with hypercalciuria and salt wasting. So these are all the biochemical changes. So Barta syndrome is hypokalemic, hypochloremic, metabolic alkalosis with hypercalciuria and salt wasting. So regarding the classification, there are previous classification have classified the Barta syndrome into majorly three, that is antenatal Bartas, classic Bartas and transient Bartas. So if you see in the antenatal Bartas, as the name indicates, so antenatal Bartas, as the name indicates, the onset is in the infancy, early infancy, and they have more severe phenotype. So this is regarding antenatal Bartas. They are diagnosed in the infancy period itself, and they will have more severe phenotype, that is antenatal Bartas. And the second one, which is the classic Bartas. The classic Bartas usually little older age group, that is older childhood period, they may get the classic Bartas, and also they may have perinatal onset. In the history, they will be having maternal history of polyhydramnios, neonatal salt wasting history, and recurrent episodes of dehydration. In older children, they may present with failure to thrive and recurrent episodes of dehydration. So this is the presenting feature of classic Bartas. So antenatal Bartas, early onset with a more severe phenotype. Classic Bartas, little older age group. Perinatal onset, if you see, there will be history of polyhydramnia, salt wasting and recurrent episodes of dehydration. And in older childhood, they present with failure to thrive and recurrent episodes of dehydration. So this is the older classification, and they also classified third one, which is the transient Bartas. As the name indicates, it will be there for a particular period of time, then they resolve spontaneously. So these are the three classification, which was the older classification. Moving on to the current classification. So current classification of Bartas depending upon the anatomical site which is affected by the genetic mutation. So anatomical site which is affected by the particular gene mutation. So based upon that, the current classification of Bartas is this. So Bartas are classified again 5 types. Barta syndrome 1, 2, 3, 4, it involves 4A and 4B, and Barta syndrome 5. So if you see, all the Bartas types are autosomal recessive in common, except this Barta syndrome 5, which is X-linked recessive. Okay, so these are all some of the MCQ clinches you have to remember. So all the Barta syndrome are autosomal recessive except which is Barta Syndrome 5, which is X-linked recessive. And based upon the genetic mutation on the particular anatomic site, again they are classified. So first Barta's is similar to the, if you see, Barta Syndrome 1, 2 and 4. It will come under antenatal onset in comparison with the older classification. It will 1, 2 and 4 will come under antenatal Barter. Barta Syndrome 3 will come under classic Barter. Okay, this is just to show you the similarity between the older and current classification. So in Barta Syndrome 1, main gene mutation is the NKCC2, that is sodium potassium 2 chloride tau transporter channel is affected, and the gene is SLC12A1. And regarding antenatal Barter, as I already said, it is early infancy onset. There will be history of polyhydramnios, prematurity. The metabolic parameter is hypokalemic, hypochloremic metabolic alkalosis along with nephrocalcinosis with or without concentrating defect. So this scenario is common for both Barta syndrome type 1 and type 2. But the genetic mutation which has been involved is different. So type 1, it is sodium potassium 2 chloride cotransporter channel is affected. Type 2, the ROMK, that is renal outer medullary potassium channel is affected, and the gene involved is KCNJ1. So regarding MCQs, you need to remember all these things. So because some important topics you have to learn in and out. One such topic is Bartas and Jittermans. So ROMK channel and the gene involved is KCNJ1. Barta syndrome type 3, which is again autosomal recessive. Specifically, the chloride channel KB is affected in classic Bartas, and usually the age of presentation is a variable age at presentation, and the severity, it is corresponding to the type of genetic mutation that has been involved. So this is regarding the classic Barter in older classification, whereas Bartas type 3 in newer classification involving the chloride channel KB. Okay. So Barta syndrome type 4 and type B, type 4A and B, which is again autosomal recessive, and it involves two channels, that is chloride channel Ka and Kb, associated with sensory neural deafness. So this is again another MCQ. Which Barta's variety is associated with sensory neural deafness? Then it is Barta syndrome type 4. Last is the transient Bartas. The gene involved is MAGED, that is melanoma associated antigen D2, that is melanoma associated antigen D2. So this is the MAGED gene, that is MAGED2 gene. As I already said, it is similar to that of transient Bartas, so where the symptoms resolve within first few months of life. So this is the current classification of the Barta syndrome. There is one more Barta syndrome, which is the autosomal dominant variant of Barta syndrome, where the defect is in the calcium sensing receptor, that is CASR. That is autosomal dominant form, one more form. So calcium sensing receptor has been affected, and there will be hypocalcemia and hypercalciuria, along with it suppresses the parathyroid hormone. So that we will be looking in the later slides. So at present, just remember the 5 variants of Barta syndrome. All are autosomal recessive except type 5, and sensory neural associated is type 4. So this is enough for the classification.